Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel, and I wanted to talk today about something that I blogged about before, but I know there are a lot more people who listen to my podcast than who read or have read my blog on the Podia site, the Acupuncture Insider blog. So what I wanted to talk about, I was reminded of by a new patient that I'm seeing who came in with symptoms of a C5-6 radiculopathy and can't lift. Well, she's a dental hygienist, and she needs her right arm. And when she abducts even a little bit, she gets pain in the arm, the upper arm, and numbness or tingling into the thumb and index finger. And the first time she visited, I did figure out that it was more of an infraspinatus issue, but she was very needle sensitive. She had been left by an acupuncturist with needles in on her first visit, left the room, and she was face down, and she had a panic attack because she was just kind of hyper focused on the fact that she couldn't move. So my treatment of her was one muscle at a time using my point stimulator, the Pointer Excel. And we were able to get through the whole treatment. But because of her anxiety, I put off treating the infraspinatus trigger point until her second visit. So I saw her this week for her second visit. And I said, okay, and she was feeling a lot of relief in the arm as far as the arm pain went, but she still had pain or numbness on abduction of the arm. I said, okay, so today, primarily we really need to work on that infraspinatus trigger point. But let me back up real quick. She is the fifth person that I've seen in a year who had symptoms of a radiculopathy that were actually resolved by treating an infraspinatus trigger point. And by the way, that trigger point is usually about midway near the medial border of the scapula. So if you find the medial border of the scapula and you bisect it, just lateral to that location, you will probably find a trigger point that is very painful on pressure. And if you put some ischemic compression on it, you will reproduce the numbness and tingling into the hand, and some pain going down the arm. It travels along the radial nerve pathway, so through the brachioradialis area. The pain usually ends right there, just below the elbow, but the numbness tingling is definitely noticeable in the thumb and index finger. So the 5 people that I've seen who had this had very similar problems where one of the women that I saw, she couldn't put on her makeup and fix her hair without her hand going numb. She would shake her hand. It was actually the index finger and thumb, but she described it as her hand going numb. And she would then shake her hand to feel like she could get some blood circulating back in it. The guy that I saw whose doctors wanted him to have neck surgery because he did have some disc issues. in his neck around the C5-6 area. They were insisting that he needed surgery, and he wanted to try something different first. So he tried acupuncture. And his problem was, for the past year, if he wanted to drive with both hands, his arm would immediately start hurting, and his thumb and index finger would go numb. And so he learned, basically he just had to drive his 30-minute commute in the morning and in the evening with his right hand on the seat next to him, because anytime he lifted it, it would start to hurt and go numb. And then the woman that I'm seeing now, she's the dental hygienist. Same problem. She works all day with her arm out, and that makes it really difficult. It can't be fun trying to work with a numb, tingling hand. So, and I'm going to put a link in the description on this podcast for a journal, a medical journal entry that was about differentiating C5, C6 radiculopathy from infraspinatus trigger points. I think you'll find it interesting, and it's worth looking at or giving to patients if you are treating them for this, so they can see that it's a legitimate thing that has been found by others. In this case, it was physical therapists who found the trigger point on a dentist who, in the case, the dentist was 38 years old, and he had developed neck pain and this arm pain and numbness, and the doctors suggested he needed surgery. So he did have a discectomy and fusion, a C5-6 fusion from the front, and his pain was gone for 4 months, and then it came back. Before surgery, he was living with, on the VAS scale 1 to 10, he was at a 9 out of 10 constantly by the time he had the surgery. When the pain came back, it was a 6. He was playing with his daughter, and it came back, and it didn't go away. It was around a 6. So they'd already done surgery, so they sent him to physiotherapy, and in the process of being evaluated, they determined that he had a trigger point in his infraspinatus that they could reproduce the pain by an ischemic compression on the infraspinatus. So that they attempted to deactivate it on that first visit, and they used some kinesiotaping and some stretching, and he already, after the first visit, was feeling relief. So over the course of his treatments, they were able to deactivate that trigger point, and they talk about shockwave therapy and dry needling in the case for that. So okay, so let me get back to my dental hygienist. She said, "Oh, by the way, I'm not nervous about the needles. I was nervous about being left in the room with needles. So you do whatever you got to do. I'm here for it." And her father is a physical therapist who doesn't live in Buffalo, and he sent her to me. He Googled, found me, because my website says, dry needling. Her father is a big fan of the Travell and Simons books, and actually has a signed copy. He met Janet Travell long time back, and she signed his copy, and she showed me a photo of her dad's signed copy. It's pretty cool. So her dad knew what was going on, I think, and said, "This is what you need." And he sent her to me. So she was fine. It's dry needling is not fun. Like, getting trigger points released with a needle is never fun, especially if it's an active trigger point, because it's kind of painful already. But anyway, so I had her face down in the face cradle on the massage table with her arm by her side, so that I could put some pressure on the trigger point to see where the most active spot was. And it was very easy to find. and she felt the tingling. So I was able to deactivate about 50% of it. It was very uncomfortable for her. I could tell she was putting up with it, but after I got about half of it deactivated, I suggested that we let it heal, and we'll work on the other half when I see her. But I said I think you're still going to feel a decent amount of relief, and she did. She was able to then abduct her arm and have less pain and less tingling. Um, so I feel like after it heals for a couple days, it'll even be better. Um, the guy who had a hard time driving, the first time I treated his trigger point, and that was also uncomfortable. Um, I told him your arm probably be weak and sore, and this may take us a few visits to deactivate this trigger point. But he texted me after he got home, and he said, "I think you're onto it because I was able to drive all the way home without numbness or tingling in my hand." So I think I only needed one follow up with him for that trigger point. He's now a regular patient, but not for any sort of neck issues. He's had some like a shoveling injury of his low back and a hip injury, and I see his wife, who's a nurse, and because of his treatment with me, he sent her to me, and she had a hip impingement that was just she'd had for years, and we were able to resolve that in one visit. Um, so I see her occasionally for tune-ups for different things, but not for the hip. For different, like the last time I saw her was more for her neck levator. So anyway, the point of that is that once you deactivate those trigger points, they rarely come back. Um, I I've like I said, I think I've seen 5 this year, and they don't come back. The patients come back because they realize that they prefer to have their necks and traps and levator loose so that they're not stiff. They can parallel park without groaning. Um, but the radiculopathy symptoms don't come back. So the I guess the point of what I wanted to cover today was that if you have somebody with these symptoms, it's always worth checking the infraspinatus, because my opinion is if you don't clear that trigger point and you only treat segmentally, like C5-6, it's not going to get better because it's not coming from a nerve compression at the cervical spine. It's this crazy trigger point referral, which I find kind of odd. I haven't, even in this journal, they don't attempt to explain how that happens. But it does, and we know, and it happens a lot. So if you see these patients where holding their arm out either in front of them or off to the side gives them this C6 dermatome paresthesia, numbness, tingling in the thumb or index finger, consider the infraspinatus trigger point. Just check it and see if that's it. Because one, if they're coming to see you, they probably didn't get relief from the standard of care, and probably trying to avoid surgery. And if they're unfortunate, like this dentist in the medical journal report, or like the patient that I had where they were telling him he needed neck surgery, you're going to spare somebody going through an unnecessary surgery if you find this trigger point and release it. The guy who had a problem driving, his doctors were contacting him to say, you really should get this neck surgery. And he said, I'm getting acupuncture, I'm feeling better. And of course that that goes across something like, my psychic reader told me not to go, because they don't really know that that not all acupuncturists are treating the same way. But once he had relief, he was confident he did not need surgery. He was fine. He felt good. He had no numbness. He had no weakness. There were no symptoms of nerve compression in spite of the disc issue that he had. And I think it was like an anterior disc bulge. So anyway, I'm just putting it out there. And he doesn't really suffer from that disc issue. He doesn't really come in for a lot of um, neck, upper extremity stuff. Like I said, I've seen him more for like low back and hip stuff. So imaging is important. It's helpful, especially to rule things out. But things that we see on the imaging are not always reliable as when you're looking for the root cause of a problem. The problem with trigger points for us as people who palpate for them and treat them is that they don't show up on imaging. So it still falls in the world of alternative medicine, even though physical therapists are doing dry needling on trigger points and acupuncturists are doing it. It falls outside of accepted, medicine, because you can't do an objective test for those trigger points. They do rely on a trained person to actually palpate, locate, and reproduce the issue, and that's not seen as objective. They in order for trigger points to come into the world of Western medicine standard of care, there needs to be an objective test that can be applied. So it doesn't really show up on a CT scan. It doesn't show up on MRI. It doesn't show up on X-rays. Ultrasound. Apparently, you can do a kind of ultrasound with Doppler that can show trigger points, but it's so prohibitively expensive that it will not be used in normal assessment. So, we're their last hope before surgery. So if you find somebody with these symptoms, it's really worth just checking. And I'm not saying that they won't have C5-6 on their MRI when they come to see you. I'm just saying it's not the be all and end all of why they are having the problem. We still need to work outside the box and look for things like trigger points. So, yep, that's it for today's episode. I hope you found it interesting and have a great week. I will talk to you soon.